Very good morning to you all. The first three speakers have given an overview of the current scenario of research that's going on in the country. So I took a little detour and looked at the historical aspects. So this is just a review of the studies which have been conducted thus far and has very little of my team's contribution to this particular collection. So we begin the thing with an ode to the stalwarts. Some of the stalwarts whom the freshers would have never had the opportunity to see. Some of us have met them. Some of us have even interacted with them, and which probably seeded the inquisitiveness to work in the field of Parkinson's disease. We talk about two great neurologists who gave us the early reports on Parkinson's disease. First is Dr. Niyogi TP, who was a clinical surgeon. That used to be a position once upon a time, who diagnosed or who identified unusual, people suffering from an unusual type of Parkinsonism. They were basically miners from the Madhya Pradesh region, and they were chronically exposed to manganese intoxication because these are the manganese mines. And they found reversible Parkinsonism after inhalation of pesticides. So that was another subset. He sent these patients for treatment under Dr. N.H. Vadia, and they found that, these were indeed typical Parkinson's disease patients, and that probably set the tempo for Parkinson's disease focused research in our country. Another stalwart whom most of us in Bangalore know is Professor R.M. Verma, Professor Raja Martand Verma. He's a neurosurgeon by profession. However, he had great interest in Parkinson's disease, and in his primary attempts, which were in early 60s, he did a chemical lesion of the thalamus. So this is the chemical thalamotomy. And this micro-lesioning brought in an arrest of the tremors that were seen in the Parkinson's disease patient. This was dramatic because, one, it was very economical and it had a shorter route for control or arrest of the symptoms. So subsequently, when they examined the lesions, they found that actually the identified goal was thalamus, but in some of the patients, they saw that it was 1.5 centimeter below the thalamus, which turned out to be the subthalamic nucleus, which is now the gold standard for deep brain stimulation in all the Parkinson's disease patients. This is another study which attracted me to Parkinson's disease. This is about a mouse study where they lesion this is a rat study where they lesioned the adult rats and transplanted a fetal dopaminergic tissue in the striatum. And they allowed the rats to survive for around 300 days. And they found that these the dopaminergic neurons as well as the striatal MSNs, they develop Parkinsonian pathology when they were allowed to so these rats, which lived for a longer time, for 300 days and plus, developed the pathology, though they had fetal tissues. Now, fetal tissues are not supposed to have the Parkinsonian features. But when the fetal tissue lives in the host tissue, which has been lesioned to develop Parkinsonian symptoms, the fetal tissue itself develops Parkinsonian features, which went on to say that although to begin with, the fetal tissue was non-pathological, but it was able to contract, and which became the basis for a study which was done a couple of decades later by Dr. Jeffrey Cordova's group. And in that case, these were patients who actually received fetal nigral transplants. They lived for more than a decade and a half in many cases. So 14 years later, when they examined the brain of the patients, they found that the fetal transplanted tissue, nigral tissue, expressed tyrosine hydroxylase, express VMAT, that's the vesicular monoamine transporter. Both are the markers of dopaminergic neurons, but these cells did not express dopamine transporter. That means these tissues did not have the ability at the end of its own life within the host tissue, it did not have the ability to sustain its capacity to produce dopamine. And that also became the basis for the subsequent studies where it was shown that alpha-synuclein, which was present in the host tissue, that is the patient's tissue, was also seen to be present in the fetal nigral transplanted tissue, which showed that the alpha-synuclein has prion-like properties. Now we come to a little later decades in the history of Parkinson's disease research in India. This was so the data that we have collected has been in the last 25 years, but we have excluded genetics for obvious reasons. Shweta smiles at me. Thank you. So this particular meta-analysis showed, so here we've excluded genetics and presence of neuroinflammatory protocols. So this particular study showed that there were at least 789, maybe more. This is an approximate that we are presenting over here, of which 409 were clinical studies and 380 were basic science studies. So amongst the basic science studies that have been conducted in India, about 150 were on ethnopharmacology. So there is a momentum in that aspect, that people are interested in understanding the role of phytoceuticals in rescuing Parkinsonian symptoms. There are studies on small molecules, mitochondrial targets, and using different experimental models like the rodents, zebrafish, Drosophila, as well as Caenorhabditis. So what I have done for today's presentation or discussion with you is that I have looked at studies which are focused on critical factors that govern the Parkinsonian symptoms or manifestation. Here we have the clinical correlates, the epidemiology, pathogenesis, as well as genetics. I've kept genetics towards the end so that I can conveniently skip it. So when we look at the clinical correlates, we talk about motor fluctuations in terms of the motor difficulties that the Parkinsonian patients suffer from. There is neuropathy, there is sleep disturbances, particularly the REM behavioral disorders that we see, loss of olfaction, which also forms as a part of the prodromal syndrome, restless leg syndrome, as well as impulse control. Now, these have been conducted by all the proponents of movement disorders. They are all movement disorder specialists. We can call them the guns of Navarone, followed by the Force 10. I think most of us know about them through their names, but let's give a face to them. Dr. B.S. Singhal, who was the first neurologist to form the Society for Movement Disorders Society in India. Dr. Madhuri Bihari, Dr. Shamal Kumar Das. They are from so Dr. Madhuri Bihari is from New Delhi, from Dr. Shamal Kumar Das is from Kolkata, and the lower panel is from Bombay, Dr. Mohit Bhatt, Dr. Uday Muthane, Dr. Rupam, and Dr. Asha Kishore. So the best part is that they are from the different geographical locations of the country, but have a common goal of understanding and addressing the issues faced by Parkinson's disease patients. Now, these are a few clinical studies which I have gathered or tried to tabulate, and they talk about the different clinical symptoms in Parkinson's disease or Parkinsonism. So they've tried to compare the early onset, whereas as well as the juvenile Parkinson's disease. This was conducted by Muthane and his group, and they found that both these patients had similar clinical profile, but the juvenile Parkinson's patients had more autonomic involvement. So they had loss of autonomic functions. Subsequently, Dr. Bihari showed that 50% of the patients had motor fluctuations, and they were commonly seen in the young onset Parkinson's disease. Thereafter, there were a couple of studies where the screening questionnaires were adapted to the Indian society, because most of the times we see that screening questionnaires where, the questions are asked to the patients to understand the disease pathology were based earlier on the European or American standards, but then they were adapted to our Indian scenario. And it happened, and it has again now gone to an extent that you have vernacular questionnaires also. And as we all know, you would be you would be seeking institutional ethics committee clearances, and in the human ethics, you have to have questionnaires in the vernacular languages, your local languages. So these were the efforts made by some of the pioneers. There are studies on sleep, REM behavioral disorders, and they saw that 42% of the patients had sleep disturbances or daytime sleepiness. There was again a study on olfactory dysfunctions, and here again they used Indian sleep smell identification test to make it easier for the local people. Then there was a study on restless leg syndrome as well as impulse control disorder and cognition. So studies from NIMHANS have also shown that there is an involvement of autonomic dysfunctions, like the PD patients showed 94% restrictive pattern of the respiratory involvement. There are neuropsychiatric correlations with the obsessive compulsive disorders, as well as loss of oculomotor function, and including speech, where Dr. Shivshankar has made significant contributions. There is also urogenital involvement in the PD patients. Now we come to the second aspect, that is the epidemiology. As Shweta said, that it is good to look at the population genetics. So it is also another modality where people look at the prevalence in the population to understand what is the pattern of the disease in the Indian population. So epidemiology estimates, they provide us ideas of the incidence or prevalence of the disease, its distribution pattern, and one can identify possible control mechanisms. As we saw that there were several patients suffering from PD in the areas surrounding the manganese-associated mining activities. So if there are any possibilities to control those parameters or identify other factors relating to health, and one could also understand the neuroanatomical basis of this prevalence. So now, as far as the epidemiology of Parkinson's disease is concerned, there have been several studies which have been conducted in last 4 or 5 decades. One of the interesting studies was in the Bombay region on the urban Parsis. Okay, I'm sorry. So this particular study showed that there was a higher prevalence in the Bombay Parsis compared to the other Indians, where the population was just around anywhere from 14 to 53 per 100,000, but it has increased in the last this thing. So there is a lower prevalence of Parkinson's disease in Asian Indians. There was a landmark study by Dr. Muthane and his group which showed the neuroanatomical basis for this lower prevalence of Parkinson's disease, and that was related to absence of loss of dopaminergic neurons with aging in these cohort. We have subsequently provided the basis through quantification of several parameters in our laboratory and have developed an animal model for differentialist. Now, Shweta has already talked about the PD genetics, and she also mentioned, Prashant also mentioned the presence of Lux Giant Consortium all over the nation. Now we come back to the fundamentals. There have been, as I talked about, several studies which are focused now on ethnopharmacology and identifying different targets. Now here, when we talk about alpha-synuclein, which Ravi has elegantly mentioned, there are, as well as Lata has mentioned, there are several studies which have used different animal models and try to understand the mechanisms, and somewhere they have used interventions like Bacopa monnieri suetamin, as well as other botanical products to understand whether these pathological progression can be rescued at a certain time point. Autophagy modulation, Ravi has already elegantly described, and he has moved on to not only from the rodents to the faster, the the animal models which give a faster and more reliable answer. And so is the case of mitophagy. Antioxidants have been used in recent times, and so has been another modality. So these particular studies have looked at behavior-based changes. So there they have given major focus on behavior, that is kind of here, which is assessed by locomotor activity. And several studies have again come out from these aspects. Just a brief about the ethnopharmacologic associated aspects. So here we have Mucuna pruriens, Curcumina longa, Ginkgo biloba, and Georgie. So as we see, I'll just wind up in one slide. As we see, Indian contributions have been extensive and very emphatic and effective. We have got answers to the questions raised by epidemiology in terms of therapeutics through allopathic and ethnopharmacological interventions, through pathogenesis as well as genetics. So this is the emerging link. We are quickly fitting in the fluid biomarkers and validation as Albert has suggested, and Dr. Prashant would like to assure you that we would be definitely interested in this particular aspect and look forward to your support. So the topic which Prashant proposed to me was kind of me, an ant, looking up, trying to understand the different aspects of, I'm not even a scientist here, I'm just an ant looking up the different aspects of the elephant behavior. But then we quickly put my team into action. We all independently collaborated and brought up this presentation today. My early learning in Parkinson's disease was also influenced by Professor Heiko Brack, who I had the fortune to meet him, and my team of PhD scholars helped my learning stabilize better. And who better than my collaborators who contributed towards my learning, who expedited my process of learning. Thank you very much.
We can have